అయ్యింది సార్ అయ్యింది సార్
నాకు ఒకసారి పెట్టరా ఇదేనా ఇప్పుడు
అవ్వలేదు.
అవ్వలేదు ఇంకా ఇదేనా
ప్లే ఏమైనా వస్తాలేమో. సెకండ్ వన్ ఇగో 1 వెయిటింగ్ అని వస్తుంది.
ప్లే కొట్టినాం కదా ఇంకేముంది నువ్వు చూడు విజయ్ ఇంక అంతేనా
అంతే స్టార్ట్ టైమింగ్ స్టార్ట్ అయ్యింది సార్
ఫార్మకాలజీ అని ఉంటుంది కంప్లీట్ ఫుల్ ఫామ్ సార్
చాలా వచ్చాయి దీంట్లో. ఫార్మా వన్ కాదా? ఫార్మకాలజీయా?
విజయ్ ఎట్లా విజయ్ ఇప్పుడు మీరు చెయ్యి
ఏదో ఒకటి మాట్లాడు సాయితి, తెలుస్తుంది.
అసలు ఇక్కడ నాకేం తెలియట్లేదు ఇది ఇందాక ఇట్లా లేకుండే కదా
ఒక్కసారి
స్టార్టెడ్ అంట. Yeah, it's coming. It's coming. Okay, start side.
So I'm so sorry, there was a little network issues. So I think everyone can see me now. And I hope the screen is clear. So we'll be continuing the class. There will be no more disturbances now, hopefully. So everyone, welcome back. So now, as I already asked, the IV is 100%, and yes, many of the students have given the IM also right as 75% or 80%. So max you can go for 75, but less than 100. Okay, and then subcutaneous is again 75 to 100. Oral is 5 to 100. Rectal is 30 to 100 or less than 100. And inhalation is 5 to 100, and transdermal is 80 to 100. Okay, so I hope it's clear. So this is a direct table taken from your PP books. So during revision, just do give importance to this as well. Okay, so we are going for the next question. I hope it's clear, everyone. Yeah, so half-life remains constant in first order kinetics. Is it true or false? So I'm waiting for your answers. Half-life remains constant in first order kinetics. Is it true or false? Yeah, very good, dear students. It is true. Okay, we'll be going with the explanation now. So as you can see, this is the first order kinetics and zero order kinetics. So half-life remains constant in the first order kinetics. So constant fraction of drug is being eliminated, FF, constant fraction of the drug is eliminated per unit time in first order kinetics, whereas in zero order, amount of the drug will be eliminated in the unit time. Okay, so fraction in the first order kinetics, whereas amount of the drug is eliminated in the zero order kinetics. Okay, so what you have to actually remember more in the true or false statement type is regarding the clearance and the half-life. So clearance remains constant in the first order kinetics and half-life also remains constant in the first order kinetics. Okay, and very importantly, the rate of elimination is directly proportional to the plasma concentration. Okay, so the rate of elimination is proportional to the plasma concentration. Okay, so these are the important points of the first order kinetics. So as we have discussed, the half-life remains constant in the first order kinetics. And rate of elimination is proportional to the plasma concentration in first order kinetics, and constant fraction of the drug is being eliminated in unit time in first order kinetics, whereas for the zero order, constant amount of the drug is being eliminated, and the half-life and the clearance also gets changed, as you can see in the picture. So you have to know this, because many times I have seen the true or false statements are being asked with respect to this. Okay, so we are going to the next question now. So drugs that follow the zero order kinetics are Can you tell me the drugs that follow zero order kinetics are? Yes, very good, Dr. Arpita, very good, Shrida, very good, Dr. Richa. So all the above. Okay. So which follows zero order kinetics? There is a mnemonic given in your PP books. So that is, can anyone tell me the mnemonic for the zero order kinetic drugs? So this is the mnemonic for the zero order kinetics, that is watt power. Okay, warfarin, alcohol and aspirin, theophylline, tolbutamide and phenytoin. So these are the drugs which follow zero order kinetics. Means what does that mean? The majority of the drugs follow first order. So except these, that is warfarin, alcohol and aspirin, theophylline, tolbutamide and phenytoin. So many times I have seen question with respect to the phenytoin as well as alcohol and warfarin. Like they ask in related to these. Okay, so which order kinetics that warfarin follow? Or the zero order kinetics, a constant amount of drug is being eliminated, right? So like that also questions will be asked. So which of the following drug a constant amount of drug will be eliminated in unit time? Then you have to go for zero order kinetics, and all these will be the examples of that. So watt power, warfarin, alcohol and aspirin, theophylline, tolbutamide and phenytoin. Now coming to the next question. So total elimination of the drug will take maximum or about how many number of half-lives? That's very good. It is almost 5. Okay, so 5 half-lives is the answer. So answer for this question, it is 5 half-lives. Okay, so we'll be going to the explanation. So yes, very good all the students, absolutely good. It is almost 5 half-life. So if 5 option is not there, maybe you can go for 4. But don't go for the other options. 2, 3, 10, 7, all those is not the answer. Okay? Yes. So now as you can see, this is the sir's handwritten notes that is always also discussed in your WhatsApp discussions. So first half-life, how much is being eliminated? That is 50%. Second half-life, it's 75%. Third half-life, if you see the calculation that is being given here, 87.5. Okay. So most common phase 2 metabolic reaction is? Can anyone answer? No? So the metabolic reactions, I'll just give you the explanation for that. So metabolic reactions are broadly as the phase 1 and phase 2. So phase 1 are non-synthetic which attach the functional drug molecule, okay, and they may be water or lipid soluble, and phase 2 attach a conjugate to the drug molecule and they become water soluble. Okay, so these are the important things that you have to know with respect to the phase 1 and phase 2 reactions. So coming to the phase 2 reactions. So phase 1, as you can see, it is the oxidation, reduction, hydrolysis, and in oxidation, the hydroxylation, dealkylation, and deamination. Whereas phase 2, the microsomal, very important and most common is the glucuronate conjugation. Okay, it is very, very important. It is the most common, that is glucuronate conjugation. Glucuronate conjugation is the most common phase 2 reaction. Okay, I hope it's clear. Now coming to the next question. So the Km is unchanged in non-competitive inhibition, true or false? And Vmax is decreased in non-competitive inhibition, true or false? Means Vmax is changed in non-competitive inhibition and Km is unchanged in non-competitive inhibition. Is it true or false? Yes, very good. It's true. There is a reason. I'll be explaining it to you now. So if you see here, there is a competitive inhibition and there is non-competitive inhibition, right? So in non-competitive inhibition, the non-competitive inhibitor is binding at some other site. Okay, so it is binding at a different site than the site of actual where it has to be. It's binding at a different site. So even if you change, what is Km? Km is a substrate concentration at a particular velocity, right? So what is the purpose of changing the Km? Because it is binding at other site and it's doing its action, right? So you remember like that. So even if you change, even if you increase the Km, even if you do whatever, the effect of the inhibition that has to happen will happen. The main purpose is to decrease the Vmax, so that will happen. So Km, since it's binding at a different site, as you can see in the picture, it is showing its effect. Okay, so Km will be binding at a different site. So no point of changing the Km of the substrate or of the drug. Here we are discussing about the drugs, right? So there is no point of changing the Km or the substrate concentration because why? It is binding at a different site and it is doing its work. That is decreasing the Vmax. So our question is, Km is unchanged in non-competitive inhibition? Yes. Next, Vmax will be changed in non-competitive inhibition? Yes. Okay, so both are true. Okay, I hope it's clear. Now coming to the next question. So here, the post-marketing surveillance is seen in which phase, or it's nothing but which phase of the clinical trials? 1, 2, 3, 4. What will you go for it? So very good, students. It's D. So here is the explanation for that. So this table is quite important. It is covered in your smart videos also. So phase 1 is human pharmacology and safety. Phase 2 is therapeutic exploratory. Phase 3 is therapeutic confirmatory, and post-marketing surveillance table A to Z, you have to have an idea. Okay, I hope it's clear. We'll be going to the next question. Yes, now what do you mean by therapeutic index? Just the formula or just the glimpse of it. What is therapeutic index? What does it measure or what it is referred to? Very good. You have given an absolutely correct formula, Dr. Sridhar. Yes, it is referred to the safety of the drug. Okay, so therapeutic index is a measure of the safety of a drug. So it is LD50 by ED50. Okay, it's LD50 by ED50. And drugs which are having high therapeutic index are safer. They're safer to use. Okay, so which are having good therapeutic index are safer. And those which are having narrow therapeutic index are not safe, like as shown in the picture. Okay, so these are not safer when compared to the safer, those who have high therapeutic index are safe, whereas these drugs have narrow therapeutic index. And most commonly in the NEET pattern, I have seen the lithium to be asked as a most common question, because lithium has a very narrow therapeutic index. So that was asked. So do note that, and others just have an idea. Okay. Yes, means they can be used. It's that we have to be cautious. We have to take the necessary investigations to the patient before prescribing these drugs. Okay, so like that we have to go ahead. Okay, yes. Now coming to the next question. The allergic reactions caused by penicillins comes under which type of adverse drug reactions? Very good, it is bizarre. Okay, so there are 5 types. Okay, so that is type A, type B, type C, type D, type E and F. So A is augmented. Okay, so for example, if you give anti-hyperglycemic drugs, the patients can have hypoglycemia. So like for example, sulfonylurea. So that is type A, augmented. Bizarre is unpredictable. It can happen. It is dose independent and it can happen. So that is bizarre. C is chronic. Okay, C is chronic. Okay, D is delayed effects. E is end of treatment. Okay, so that is regarding the 5 adverse drug reactions. Now next, coming to the angulation of intradermal injection. How much, when you give an intradermal injection to the patient, how much is the angulation that you give? Very good. Very good, students. It is around 15 degrees. So for the IM it is 90, for subcutaneous it's 45 and intradermal is 15. Okay, good. Now next question. Antibiotics that inhibit the DNA gyrase enzyme. Name the group of antibiotics that inhibit the DNA gyrase enzyme. Very good. It is fluoroquinolones or quinolones. So here is the various antibiotics and the specific mechanism of actions as you can see in the picture. So the cell wall synthesis, there is a mnemonic that is given that is tightly bound to the bacterial cell wall. Okay, so B is bacitracin, firmly bound to the bacterial cell wall. F is phosphomycin, B is bacitracin, C is cycloserine. Okay, again B is the beta-lactams, which comes where the penicillins and the cephalosporins and the carbamazepines and all will come. And wall, V instead of W, you go for V. Okay, so that is vancomycin. Okay, firmly bind to the bacterial cell wall. Phosphomycin, bacitracin, cycloserine. Bacterial, that is beta-lactams, where penicillins and cephalosporins will fall in, and V, that is vancomycin. So this is a mnemonic for the drugs which inhibit the cell wall synthesis. And next, which act at the folic acid metabolism is the thiometaprim and sulfonamides, and which act at a DNA gyrase is our fluoroquinolones are the quinolones, and the DNA dependent RNA polymerase, very important, so that is our rifampicin, and like the protein synthesis which come under the other drugs like erythromycin and all that. Okay, so you have that mnemonic also, right? So you have to plan accordingly. So these are the mechanism of actions of the various antibiotics. Okay, I hope it's clear. We'll be going to the next question. Next, hyperuricemia is seen as a side effect of which of the following anti-tubercular drug? Hyperuricemia is seen as a side effect of which of the following anti-tubercular drug? I'm waiting for your answers. No, it's not rifampicin. I'll be giving you explanations. Few students got confused here. Okay, so in a brief, what are the various anti-TB drugs? That is essential and supplementary. So essential includes the isoniazid, rifampicin, pyrazinamide, ethambutol, and supplementary includes streptomycin, rifabutin, and rifapentin. So these are the very important group of drugs, first line anti-tubercular drugs. So coming to individual discussion. So first one is a isoniazid. So isoniazid actually it inhibits the enzyme that is ketonol reductase enzyme, which is required for the mycolic acid synthesis. Okay, and what is the important side effect of the isoniazid is it causes peripheral neuropathy. So that's the reason every patient who is given with isoniazid has to be given the pyridoxine as a supplement. Okay. And next is our rifampicin. So as we have discussed, it inhibits the DNA dependent RNA polymerase and it causes orange color discoloration of the secretions. Okay, orange color discoloration of the secretions. So now coming to the ethambutol, this causes hyperuricemia. Okay, so ethambutol causes hyperuricemia. Okay, besides that, yes, it also causes the optic neuritis. There's loss of visual acuity, there's optic neuritis, but ethambutol actually causes hyperuricemia. Okay, very important. Okay, so if option is given as ethambutol, better go for that. But very important side effect of ethambutol is optic neuritis, loss of visual acuity, especially to see the green light, loss of ability to see green light followed by the red light. Okay, so this is the important points related to the ethambutol. So next, coming to the pyranzinamide. So very important related to pyranzinamide is it causes non-gouty arthralgia in 40% of the patients. Okay, it causes non-gouty arthralgia in 40% of the patients. That's an important side effect of that. And next, streptomycin, it is not hepatotoxic, remember that. And very importantly, it is contraindicated in pregnancy. It is teratogenic, it is contraindicated in pregnancy. Okay, yes. And now coming to the DOTS regimen. So I just want to ask everyone, where does a category 1 fall in? I mean, the color code of category 1 DOTS regimen. So we know that this DOT regimen is being given for the tuberculosis patients. So category 1 is what? I mean, color coding for category 1. Can anyone tell? It is red. Okay, so it's red, blue and green. So category 1 is red, category 2 comes under blue, and category 3 is G. Okay, so that is green. So category 1 red, blue and green. Okay, so just have an idea of this DOTS regimen. It's also very importantly given many times. So as an initial phase, how the question will be asked is the new sputum and a smear is positive, and initial phase, what is the regimen and what are the drugs that you want to prescribe. Okay, and maybe if it's a relapse case or a failure case, then what is the regimen? Like that questions are asked. So just practice this DOTS regimen. Okay, so coming to the next question. So what are the various amino penicillins? Just list out, students. So I'm waiting for your answer. Very good. So amino penicillins, very important. So classification of penicillins is very important, natural and semi-synthetic and beta-lactamase inhibitors. So in the semi-synthetic, you have extended spectrum. In that you have amino penicillin. So that includes the ampicillin, vancomycin and amoxicillin. Okay, so amino penicillins, this is a classification taken from your Triparty. So do note it. Okay. Now coming to the next question. So name the tetracycline which can cause vestibular dysfunction. Very good, students, absolutely Great. So you're right on the track. So that is minocycline. Okay, minocycline. So here is a handwritten notes by Dr. Shrikant. So you can see here, that's already discussed in the smart videos as well. So what are the various tetracyclines? Okay, so there's group 1, group 2 and group 3. And in the adverse effects, if you see, so vestibular dysfunction is maximum with the minocycline. Okay, diabetic insipidus is maximum with democlocycline. Photosensitivity is also maximum with democlocycline, and almost all the tetracyclines are nephrotoxic except doxycycline. Okay, so Kapil Dev is just a mnemonic for you to remember. Okay, so all the tetracyclines are actually nephrotoxic except doxycycline. Okay, and maximum photosensitivity and maximum diabetes insipidus is with our democlocycline, and vestibular dysfunction is maximum with our minocycline. Okay, great students. We are going to the next question. So what is the longest acting sulfonamide? Very good students, it is sulfadoxin. So as you can see here, the sulfonamides, again handwritten notes by Srisar. So longest acting is the sulfadoxin. Okay, so longest acting is the sulfadoxin. So intermediate is sulfadiazine and sulfamethoxazole, and adverse effects is ABC rash, and very important adverse effect is it causes a bilirubin displacement. That's the reason it ends up with kernicterus. Okay, so yes. Next question. Red man syndrome is caused by the infusion of which drug? Very good students, it is vancomycin. Okay, so vancomycin is a glycopeptide antibiotic. It is given in MRSA, that is methicillin resistant staph aureus. Okay, and if the patient is again resistant to vancomycin, you can go for linezolid. And also given in severe cases of pseudomembranous enterocolitis, it's a drug of choice there, followed by metronidazole. Means both these drugs can be given. Metronidazole and vancomycin can be given as treatment of choice for pseudomembranous enterocolitis. And the adverse effect is red man syndrome. Means what? When if it is infused in a rapid speed or more, then it causes a rash in that area. So that is a very important side effect of vancomycin. Okay, yes. So my question to the students is, radiation recall reaction is by which drug? Radiation recall reaction. So among the options I have given, right, vancomycin, doxorubicin, one more option I have given. So among these two drugs, radiation recall reaction is by which drug? Radiation recall reaction. Wow, very good, Dr. Saiti. So it is anthracyclines like the doxorubicin. Okay, so it is an anti-cancer antibiotic. So doxorubicin causes radiation recall reaction. Okay, this is red man syndrome caused by vancomycin. Now next, very important respiratory system question. Very good. So as you can see here, oxygen dissociation curve, the Bohr effect, the Haldane effect, okay, and the volumes are very important in the respiratory physiology. So as the picture clearly shows where there is left and where there is right shift, the concept is already cleared in your smart videos. So just remember this, it's quite an important area. Okay, so yes, it's true. Decreased H plus ions, you can see that it is shifted to the left. Increased is shifted to the right. Okay. Next question. So if you want to derive vital capacity, what is your formula? Very good. So all these formulas of the lung volumes and lung capacities are very important, and the values are also important. So this is, answer is C, that is IRV, that is inspiratory reserve volume plus tidal volume plus expiratory reserve volume. So that is the derivation for the vital capacity. So please note this table, already covered in your smart videos. Okay? Yes. Now next question. So what is a regimen that you give for H. pylori? Very good. It's a CAP regimen. Okay, so CAP regimen includes the clarithromycin, amoxicillin and the PPIs. Okay, that is a very important regimen. Besides that, as per your Harrison textbook and as per the other therapies, these are the drugs. So how the questions are asked in your exam is, which of the following is not included for the treatment regimens for H. pylori? So like that. So all these drugs are included. Other than these drugs, you can eliminate by that. So the colloidal bismuth sulfate, metronidazole, tetracyclines, all these are also included, but the specifically CAP regimen, if they ask, you have to go for clarithromycin, amox and the PPIs. Okay, so those patients, whoever is having the peptic ulcer, if they have been came to know that through investigations that H. pylori is the cause, then for those patients you will give the CAP regimen. Okay, according to Harrison, you can go for the quadruple therapy as well, but very important and the commonly asked in the NEET pattern is a CAP regimen. Okay, yes. Now next question. Please answer. Very good. The valproate. Okay, so these are the generalized seizures and the focal seizures. So generalized are the tonic-clonic and the absent seizures. Tonic-clonic seizures are also called as grand mal seizures, and absent seizures are also called as petit mal seizures. Whereas coming to the focal seizures, with awareness and impaired awareness. So with awareness you have simple partial seizures, and with impaired awareness you have complex partial seizures. So these are just the basic idea of seizures, and these are the various drug of choices. Okay, so for the generalized tonic-clonic seizures, you give the calcium and the sodium channel blockers. For the myoclonic seizures also, you can give the calcium and the sodium channel blockers, except carbamazepine and phenytoin, because they cause juvenile myoclonic epilepsy, JME. So that's the reason in myoclonic seizures you're not supposed to give. In absent seizures, what is the drug of choice is a valproate. And in partial seizures, again you can go for sodium channel blockers, that is carbamazepine. Okay, yes. Now next question. Very good. So the macrolides are the drug of choice for pertussis. So here if you see, the claw is a mnemonic for the macrolides. So macrolides, you know, azithromycin, erythromycin, clarithromycin, all these are macrolides which have the large cyclic ring. So claw, C is cancroid, campylobacter and cornybacter. Then L is Lignoella, which actually causes pneumonia. Bilateral pneumonitis will be there. And A is atypical pneumonia, and W is whooping cough. So whooping cough, other name for the pertussis. Okay, so pertussis is caused, it causes, other name is whooping cough. So what is the drug of choice? How the patient will be there is, the patient is coughing, the sputum is scanty. So such type of question will be asked. What is the drug of choice? So you have to go for whooping cough, and the drug of choice is any of the macrolide. Next question. Very good. The tricuspid and the mitral or the atrioventricular valves. Okay, so S1 heart sound is because of the closure of the AV valves. S2 is because of the semilunar valves. Okay, like the aortic or the pulmonary. S1 is because of the tricuspid or the mitral. S3 is not usually seen in everyone, it's seen in children. And S4 is seen in conditions like ischemic heart disease. Okay, so all the heart sounds in the cardiac cycle, again an important area to revise, so don't leave it. Now next question. Yes, everyone is right. S1 is because of the closure of the AV valves. Absolutely right. This is the next question. Very good. Ventricular repolarization. So P wave, atrial depolarization. QRX complex, ventricular depolarization. And T wave is ventricular repolarization. So ECG waves, again important, covered in your smart videos. So do note it. Okay. Next. I'm waiting for your answers. Very good. C wave in jugular venous pressure. The pulsations in jugular venous pressure, they are like form of waves. C wave, A wave, X, prominent X descent, normal X descent, Y descent. So all these are the waves that I'll be showing you. So C wave is representing the tricuspid bulging. Okay, so I'll just mark it. It is representing the tricuspid bulging. So this is that. So very important, every alternate NEET exam, I have seen the question related to these waves. So you have to note it down. No matter what, you can expect definite question from these waves. Okay, so A wave, atrial contraction. C is tricuspid bulging or tricuspid valve closure. All that. Okay, so you can just note the waves like this. And I'll be giving you the explanation also. So the A wave corresponds to the right atrial contraction as already shown in our previous picture. C waves, ventricular contraction and the tricuspid valve will bulge. Okay, as already shown. The X descent will follow the wave, like it will follow the A wave and will have atrial relaxation. The Y descent corresponds to the rapid emptying. Okay, so as you can see here, Y descent, atrial emptying, right? X descent is following the A wave and it is showing the atrial relaxation. Okay, it is showing atrial relaxation. Y descent, rapid emptying. Okay, C wave, tricuspid valve will bulge, and A wave, atrial contraction. So all these are very important points with respect to the waves in our jugular venous pressure. Okay, yes. Now next question. Very good, it's true. Okay, so what happens with the carbonic anhydrase inhibitors is it let like potassium ions and the bicarbonate ions to lose in the lumen. Okay, so there is loss of potassium ions in the lumen as well as the bicarbonate ions are lost in the lumen. So because of which the patients will show the hypokalemic metabolic acidosis. Okay, very important. So the loop diuretics is showing hypokalemic metabolic alkalosis because there is loss of H plus ions as discussed in our SMART videos, and thiazides hypokalemic metabolic alkalosis also discussed in our SMART videos. Okay, so these are the very important side effects of our diuretics. So classification of diuretics and the side effects of diuretics and the uses as well are important. So carbonic anhydrase inhibitors, what is the mnemonic for the uses is GAME. Okay, so GAME is a mnemonic, and what are the drugs is like acetazolamide. Okay, yes. Now next question. Yes, the Lispro, Aspat, all these comes under the rapid acting insulins. So again, your exam point of view, these insulin classifications is very important. So do note it down, the duration, the onset, all the points that are given in this table are very important. So just don't ignore it, have a glance and revise this table as well. Yes, very good students, you are absolutely right. So I'm waiting for your answers, students. Very good. In diabetic ketoacidosis, you see the Kussmaul's breathing, and this is the mnemonic for the Kussmaul's breathing. So in diabetic mellitus with metabolic acidosis patients, in diabetic ketoacidosis where there is ketones that has being released, uremia, sepsis, and all these, salicylates, lactic acidosis. So Kussmaul, again the mnemonic is also saying the same thing, right? So as you can see here, right? So do note it, quite important. So don't get confused with the Kussmaul's breathing and the Kussmaul's sign. Kussmaul's sign is the paradoxical rise in the right atrial pressure during inspiration. Okay, whereas Kussmaul's breathing is different. Okay, so that is a deep, rapid, consistent breathing is Kussmaul's breathing. Okay, whereas Kussmaul's sign is a rise, paradoxical rise in right atrial pressure. So don't get confused between these two. Okay, I hope it's clear. So uses of chloroquine. I'm waiting for your answers. Yes, it's an anti-malarial drug, but there is a mnemonic to remember all the good uses of chloroquine given in your PP books. Yeah, besides malaria, what are the other things? So this is a mnemonic taken from your PP books. So that is red lip Mahatma Gandhi. Okay, so rheumatoid arthritis, extraintestinal amoebiasis, DLE, lepra reaction, IM, pathogenic reactions, malaria and giardiasis. So all these are the various uses of chloroquine. The mnemonic that you have to remember. Can anyone tell me the AHI index that is given for the sleep apnea? So it will be for severe sleep apnea, what will be the value? So that is apnea hypopnea index. So for severe cases, it is greater than 30. Very good, students. For severe cases, it is greater than 30. This is our next question. I'm waiting for your answers. So can anyone tell me what are the CNS actions? There's physostigmine and neostigmine, which are the cholinergic drugs, right? So is CNS actions absent for neostigmine? Is it true or false? Very good, students. Yes, it is absent. So here is the table taken from your PP books. So if you see, the source of physostigmine is natural, okay, whereas neostigmine is synthetic. Chemistry, is it is tertiary amine, is quaternary, that's not that important, but oral absorption, this is quite important. So it's good for physostigmine, and CNS action will be present with physostigmine, whereas absent with a neostigmine. Okay, and these are the other things that you have to have an idea. So the effect is on the ganglion, whereas here it is with the muscle. So exact table from your PP books, have a glance to it. Okay, very good, students, you're absolutely on the right track. I'm going to the next question. So what's the importance of Edrophonium? Can anyone tell, please? Wow, very good, Dr. Sahiti. Same name, we share the same name. K. Sahiti, yes. Yes, Dr. Supraja. Yes, Dr. Keith Reddy, yes, you are right. Everyone, you are right. So it's for the diagnosis of myasthenia gravis. Okay, so Edrophonium is used for the diagnosis of the myasthenia gravis and to differentiate with that of the cholinergic crisis. Okay, so there's myasthenic crisis and cholinergic crisis. In order to differentiate between the two, like you use this drug. So if there's improvement of symptoms, it is myasthenia. If it is worsening of the symptoms, then it is cholinergic. Okay, so this is the basic thing that's quite important, taken from your PP book again. So do revise this area. Next. So cefepime is given parenterally, true or false? Very good, doctor again. So the basic classification of cephalosporins is quite important. So there's mnemonic covered in your video as well. So cefepime and cefepirone, pine, prime, Amazon prime, we remember like that, right? So those which are given parenterally are these come under that group of drugs. So do remember this. Why? Because how the questions are being asked is which of the following is true, whether it's given parenterally or orally well absorbed or not, like that it will be asked as a true or false statement. So you have to answer accordingly. So this classification again important from your Tripathi. So do have a look. Next, the drug of choice for malignant hyperthermia. I'm waiting for your answer. Yes, students, it's dantrolene sodium. So malignant hypothermia, you have to stop the triggering agents. You have to give dantrolene sodium as a drug of choice. And glucose, insulins, IV fluids, cooling blankets, twins for the malignant hypothermia. And just do have an idea of this FDA classification of pregnancy. So category A, B, C, D. A is controlled studies in women who fail to demonstrate the risk to the fetus in the first trimester. B is animal studies show no risk. Okay. And C is studies in the animals have shown adverse effects. D is there is no evidence of human fetal risk, but benefits may outweigh the risk. And X is completely contraindicated. So these are the FDA drug classification for pregnancy. Okay. Yes, this is quite important. And the classification of NSAIDs again taken from your PP books, as well as your Tripathi. So classification, they many times COX1, COX2, non-selective, selective, like that questions are being asked. So do note this, and also the important areas, especially our ketorolac is being prescribed in our dentistry. So all the important areas related to ketorolac, related to ibuprofen, related to paracetamol, related to aspirin. Okay, so all these are very important areas. So because we usually practice on a day-to-day life, so you have to have very good knowledge of these drugs. Okay, so where I'm actually going to like have a, we had a very good time together. So I'm very happy that many students have given right answers. They're exactly on the right path. So the session will be continued by Dr. Pratyusha. So she'll be continuing further. So she'll be taking care of the further session. So do continue the same spirit. Okay. So yes, thank you.